I'm gonna be your nurse today.
Okay.
How are you feeling?
I'm not doing so well.
Okay, yeah. Is it the pain in your leg a little bit?
Yeah, I'd probably say it's about a 7 on a 1 to 10 scale.
Oh, okay. Okay. That sounds. I know that probably feels a little sore.
Yeah.
It's pretty normal right now for that to be in a little bit of pain after your surgery, but I'll go see if I have any pain meds available for you.
Okay.
And then I'll bring them in.
Okay. Thank you, sweetheart.
Yeah, no problem. Oh, hello, Dr. Turner.
Hi there. How's the patient in 209 today?
Oh, she seems to be doing good. She's in a little pain, but that's expected right now.
Okay, good to hear. I talked with the physical therapist, and they should be coming in for therapy soon.
Okay.
If you just make sure to have her meds, give her meds to her soon, that would really help us out.
Yeah, definitely. I was just about to head in and give her tramadol as soon as the order came through, but yeah.
Oh, cool. Yeah, I'll go with you then.
Okay, sounds good. Let me just grab my supplies. Hello, Barbara.
Hi.
How's it going?
I'm actually in a lot of pain. Do you know when you'll bring my medication?
Oh, yeah. I'll bring them in as soon as they're available. I'm just waiting for the order. But I just want to introduce you to Dr. Turner. He was your surgeon yesterday. I'm sure you met him before you went into the OR, but he's just coming in to take a look at your amputation and see what's going on down there.
Hi there.
Hi.
I'm going to check your blood sugar while he's doing that. Is that okay?
Sure.
Do you have a finger you prefer?
No, anyone is fine.
Okay, sounds good.
Oh, that looks like it's healing nicely. The order for the tramadol I prescribed for you should be available soon. I'll be back later to see how it's helping with your pain.
Okay, sounds good. Thank you, Dr. Turner.
Have a nice day, Barbara.
You too.
Okay, Barbara, well, your blood glucose levels were a little high. You were around 340, so I think the best option would be is to go get the insulin that Dr. Shepard ordered, your diabetes specialist, and I'll go grab that along with your pain med and be back shortly.
Okay, sounds good. Thank you, dear.
Yeah, no problem. Hello?
Hi, this is Dirk, the physical therapist. Is the patient in 209 awake and ready for a PT?
I believe so. I just received her order for tramadol, so I'm heading to her room now. It may take a little bit of time for it to kick in, but you're welcome to join me in her room while I finish care so you can start your assessment.
Sounds great. I have another patient that'll only take 15-20 minutes, and then I'll be up to see her. Hopefully that should be enough time for her meds to put a little dent in that pain.
Okay, sounds good.
Thank you.
Hello, Barbara.
Hi.
So I have your tramadol. I'm hoping that helps a little bit with your pain.
Okay, thank you.
Here's that for you.
Thanks.
And then just to give you a heads up, physical therapy will be on their way up to your room shortly.
Okay.
He said about 20 minutes, so you can just get ready for him, and he's just going to help you get up and moving a little bit.
Okay.
I also
Sounds
have
good.
your insulin dose for you.
Oh, good.
Do you have a place where you prefer?
Probably
me to
just
get
my
that?
abdomen.
Okay, sounds good. Let me get some gloves on.
Okay. And is there anything I have to do to get ready for PT?
Not particularly.
Okay.
I think just rest up as much as possible, and they're going to work you pretty hard once they get up here, but it's all just to help you get better, so
Okay.
hopefully the pain meds kick in enough to help you through that.
Thanks. Golly gee, I hope it doesn't hurt much longer.
I know. We are working to get you back to feeling your best as much as possible, and I'm sure PT will be here soon to help you out with that.
Okay, thanks.
Yep, you're welcome. Have a good day.
Thank you, you too, Jenny Lee.
Morning, Jenny Lee. How are you?
Good. How are you?
How are rounds today?
It's been good. I'm actually just about to go check on patient 209.
Oh, okay. Yeah, she should be ready. I just gave her some pain meds and she is waiting for PT to come up, but you can go
Okay.
right ahead.
Okay, great. If you see them, you can let them know they can start, and I'll try to be quick.
Okay, sounds good.
Good morning, Barbara. I'm the nutritionist, and I'm here to help you today.
Good morning. I've been looking forward to meeting you. What can I do for you?
Well, first of all, how are you doing?
I'm doing okay.
Okay, that's good. I'm actually here to share some things about carbohydrate counting and lifestyle changes that I think could really improve your health.
Okay.
So we could start by talking about your diet.
Mm.
You're going to want to be looking at the amount of carbohydrates that you consume. They should be about 45% of your calories, minimum intake of 130 grams per day. Dietary fats and cholesterol should be 20 to 35%. Protein should be 15 to 20%. You should also have 25 to 38 grams of fiber, and use sucrose, fructose, and non-nutritive sweeteners, and avoid alcohol.
Okay, I don't know what any of those things mean.
Yeah.
Will you explain the relevance of
Yeah.
carbs, dietary fats, cholesterol, and protein?
Sure, anything to help you get on track to your healthiest state. And I actually have resources right here for you
Oh, great.
that outlines all of those things I just talked with you
Mhm.
about if you look in there.
Okay.
However, for lifestyle changes, we can start by reducing calories,
Mm-hmm.
and we can increase your physical activity.
Okay.
You can also reduce saturated fat, cholesterol, sodium, and decrease your weight by 10% or possibly more. But we will work with you to make the best plan to fit into your life.
Okay, the problem is, sweetheart, I like my butter. You know what I mean? You can never have enough butter when you're baking, and I love to bake. So I'm thinking, is that enough exercise for me, is baking?
So I would say that we could work with you to identify a butter substitute in baking, and maybe find new recipes that are a bit healthier that you will enjoy baking. Also, baking in your kitchen is a great way to get moving, but we should be sure to incorporate other exercises that will help control the diabetes and promote your health.
Oh, okay. Well, I'd love to find some new recipes, and I guess adding some exercise wouldn't hurt, but do you think we could possibly do exercises in the pool?
Yeah, that's a great idea.
Okay.
I'll go look into seeing what resources we have for the things we have talked about today. It was so nice to meet you, Barbara. I look forward to talking with you more.
Likewise, Turkey.
Bye, Barbara.
Bye.
Hello, Barbara.
Hi.
I'm Dirk. I'm going to be your PT for this next week or so. We're going to start out, we'll just kind of assess where you're at,
Mhm.
and we'll see how long we can make it, how short I should say we make it to get you back home. How's that
Okay,
sound?
Sounds good.
All right. How is your pain doing right now?
It's about a 7.
Okay. Was the nurse able to give you some meds before? in?
I think so, yeah.
Good. All right. Hopefully that kind of dies down a little bit. Do you feel good enough to maybe try out some exercises?
Yeah, I'll try it. I want to get home, so.
Sounds good.
Yeah.
All right. So we're gonna just do a few exercises here. We want to make sure that we're kind of keeping those muscles loose.
Mhm.
And then once we get a little more advanced, we'll work on like some balance and stuff like that. Your balance is gonna be a little bit different. You might have to use a little different muscles before we can get going. And the exercise also helps to like shrink where you had that incision and everything, so we can get you fitted for a prosthetic sooner.
Okay.
And get you back home.
Okay, sounds
good. All right. Mind if I lift this up?
Sure.
All right. And basically, just want you to lift your legs straight up if you can, and back down. How's that feel?
Fine.
Okay, do it a couple more times for me. Good. And now bend it, lift your leg up and just bend at the knee a couple times. Nice. Alright. Looks good. Just put this back on here for me. Now, I think everything looks like you're doing pretty good. Pain okay, tolerable at least?
Yeah, I can push through it.
Okay, sounds good. I mean, we'd love to get you back home as soon as we can.
Mm-hmm.
And I talked to the nutritionist a little bit earlier. She said you're a little bit interested in like working in a pool and swimming.
Yeah, that'd be nice.
All right. I mean, we may have to take a little bit of time for that. Hello.
Hello. Hi, Barbara.
Hi.
I saw or heard that you were done with PT, so I just brought in your afternoon meds.
Oh, okay, thank you.
Yes, no problem.
And as I was saying, we're gonna have to wait for you to heal all the way. We don't want to get those stitches wet, and we don't
Okay.
want everything kind of ripping open and
Uh-huh.
stuff, which is what the pool might do to that.
Okay.
But
That's okay.
once you're healed, we'll definitely get you in a pool and get you active.
Okay, thank
All
you.
right. Sounds good. It was
Thank
very
you.
nice meeting you, Barbara.
You too, thank
you.
you.
Hello, Barbara.
Hi.
How was your conversation with the nutritionist?
Great, I feel like she's going to be very helpful in understanding my diagnosis.
Oh, good. And your PT session?
It was fine. I mean, after today, I'm really feeling overwhelmed with everything. So much of my life has changed recently, and I know there's still purpose in my life, but to be honest, I'm feeling really hopeless and sad.
Yeah, that's really understandable. Would you like to talk about anything that's been going on?
Yeah, well, it started with when my husband died, and then everything just kind of went downhill from there. When I was diagnosed with diabetes, and then my foot was amputated. And now everyone is telling me I have to make all sorts of changes in my life, and I don't want to, and I wish none of this had ever happened. And I know I can trust the Lord to all of this, but it's just really hard.
Yeah, that's so understandable. And you're so right in saying that, and the Lord is with you through all of this. When I've walked through troubled times in my life, I've kept Psalms 23 really close for an encouragement. I just want you to know that you can take hope that the Lord is with you in this, and He's your comfort in this season. I know you're going through a very hard situation right now, and I'd love to pray with you and talk to you whenever you need while you're here.
Thanks so much, sweetheart. That means a lot, and I would love some prayer.
Yeah, no problem. You're so welcome. And also, I'll have a social worker come talk to you and see if there's any support groups available for you.
Like a group to meet and just talk through all these things?
Mm-hmm.
Okay.
We really do have your best interest in mind while you're here. We want you to get back to being the most healthy and most independent person that you can be. I think you're improving so much already, and if there's anything you need while you're here, just let me know.
Thank you.
Come on, I wasn't laughing at that part. Hello, Dr. Taylor.
And
What?
We need a cut.
You're a difficult patient.
It's gonna bring